Valentine's Day still a week away, but you might notice a whole lot of people are wearing red today. This is the day the American Heart Association wants people to wear red to raise awareness about heart disease. News 8's Kent Pierce spent the morning with doctors at Yale New Haven Hospital. He joined us now live in our New Haven newsroom with some tips for keeping yourself heart healthy these days. Kent.
Yeah, Keith, here's a couple of tips for you. Eat right and exercise. Well, that's good advice for anybody who wants to prevent heart disease. Knowing if you have it can get more complicated, as it turns out, especially for women. Out of the ambulance into the emergency department. It's not a trip you want to make, but so many do because of heart disease.
It's the #1 cause of death in all women, exceeds all cancers, over 500,000 women a year.
Dr. Henry wore a red tie today to help raise awareness of heart disease, something doctors here at Yale New Haven Hospital say is largely preventable.
Folks follow a heart-healthy diet, get regular exercise, and then most importantly, follow the instructions provided by their physician.
Know what your weight is. Remember that you need to exercise at least 30 minutes every day in whatever fashion you as a person are fit to do. Got to know your blood pressure, your cholesterol, and your blood sugar values.
The American Heart Association has been asking us to wear red on the first Friday in February for more than a decade now. It's for everybody now, but it began as Wear Red for Women Day because heart disease in women is actually harder to detect.
You can get severe sweating, nausea, shortness of breath, lightheadedness, any of these type of symptoms, all in constellation would be a concern.
The symptoms are often not the classic chest pressure and things like that. So it requires a little bit more perseverance and an awareness that something is wrong with their body and they need to pursue it.
Know your body and know when something changes. And the doctors here know there are lots of options for treatment these days.
Things as minimally invasive as stents inside the heart, pacemakers, or then more sophisticated options such as valve replacement or valve repair.
And of course, beyond that, there are heart pumps and transplants, but that's a last resort. So know your risk, know your numbers, weight, blood pressure, cholesterol, and blood sugar, and don't be afraid to talk to your doctor about health concerns. Live in the New Haven newsroom, I'm Kent Pierce. Keith, back to you.